Donnella Mills is a Torres Strait Islander woman. She is the acting chair of the National Aboriginal Community Controlled Health Organisation, and she is a health justice lawyer in Wuchopperan Health Justice Partnership. So Donella, first I'd love you to just share some of your story with this room, where you come from, what your homeland is like, and how you got into this work.
Before I do that, I also would like to acknowledge the fact that we are holding this conference here on Aboriginal land. I recognise the strength, resilience and capacity of the Gadigal people of the Eora Nation, the true custodians of this land. I want to pay my greatest respect to their elders, to my elders, to all elders, and I also extend that respect to every Aboriginal and Torres Strait Islander here in the room. Now back to your question, Tessa. How did I get into this space? For me, I attended the first Health Justice Conference 2 years ago, and I was a super excited lawyer around the idea of working in a health domain. Now, back at home, what I kept coming into contact with was this enormous need in my community, an unrecognised need that my people face. I kept seeing our overrepresentation in systems that are really designed for their failure, and I wanted to do things differently, and I didn't know how to do that. Attending the Health Justice Conference 2 years ago really gave me the strength to think about doing things differently, and also the language to go back home and to try to be really innovative and imaginative around doing things differently. I'm very blessed that I come with a couple of different hats. I have a significant role in my community where I am seen as a leader, and with that comes an enormous amount of responsibility and duty. So coming home with an idea of putting lawyers in a community controlled health organisation was a scary thought, and it was a scary thought for my people based on history being extremely cruel to my people. There is an enormous distrust between First Nations peoples and systems that have brought about significant disadvantage. So a lot of trust was put into me by my community to bring myself into a health space, sitting alongside doctors to be able to work collaboratively to address unmet need. And I'm really proud to say that we are 4 and a bit years down the track, and it's hard to describe how enormous a difference that has made. For my people to know that they actually have rights, the same rights that everybody in this room has, is something that they didn't know. They didn't understand that their voices actually matter. So by having myself, having LawRight, who I work for, embedded in a health system meant that we were able to do things early intervention. We were able to build capacity, and we're able to share what your rights are.
Donella, you have both served on the board of Wuchopperan Community Health Service, an Aboriginal Community Controlled Health Organisation, and you've also been the health justice lawyer working as a team member of LawRight, a mainstream community legal service, supporting the legal needs of that same community. What's it like to straddle that role between a member of a community in a community controlled sense and a member of a mainstream service providing services in that context?
That has been extremely challenging. Challenging, if I could use the analogy, where we have two systems. I have my customary way of being, which is something that is 24/7. I've often said to the executives at LawRight, I don't get to stop being black at 5 o'clock. That's something that is continuous. And then also meeting the demands of within that legal framework with LawRight, which is, my duties and responsibilities there. The two don't meet in the middle because the expectations of my community are far-reaching. The positives that have come out of that is it's been an enormous, wonderful journey that I have been on with LawRight in learning how to best build a relationship And this is a relationship based on trust and loyalty. It's not a token relationship where we come in and we do a cultural induction program. It's really about honouring the fact that community control have the power. And we are so fortunate to be able to step into that space. So yes, it's been challenging, but if I wasn't on the board of Wuchopperan Health Service, they would not have trusted to take what now doesn't seem like a big leap forward to bring lawyers into the space. They really looked to me and said, well, we trust you, you're born from this community, so we're going to give you all of the strength and all of the trust for you to bring this forward for us.
And so from those early beginnings at Wuchopperan, you're now the acting chair of the board of NACCHO, the National Aboriginal Community Controlled Health Organisation, and the peak body for Aboriginal medical services and community controlled health services right across the country. What do you see as the potential and the opportunities for advocacy at that national level and through that role?
Well, I have a great story, Tessa. So the potential, I attended Health Justice 2 years ago, left the Health Justice Conference in Melbourne, went straight to the NACCHO conference in Canberra, and I was presenting on my Health Justice project at Wuchopperan Health Service in Cairns. I left that conference as the deputy chair. So that's an example from my people. And, you know, under the NACCHO umbrella, we have 144 Aboriginal community controlled health organisations. We are so proud of our expertise, and we're not shy to let people know that community control, when Aboriginal and Torres Islander people lead, we have real impact. So that demonstrated for me that there was this real urgency to be able to bring rights and to be able to bring a legal framework into the health system. So yeah, it has been a wild, wild ride.
One of the other really significant shifts in terms of national advocacy driven very much by NACCHO is the role of the Aboriginal-led peaks and their work with the Commonwealth Government. And I'm not actually sure if people in this room are as familiar with that as you would be. So could you tell us a bit about what that is and how it came about and where you think it's heading?
Okay. So everybody in the room would be familiar with the Closing the Gap targets. So the Commonwealth Government, through COAG, last year we're doing a refresh because for the past 10 plus years the targets are not on track. Two of the targets seem to be closely, you know, getting to a positive outcome. So the government, in their infinite wisdom, went out and said, let's just refresh this process. Of course, that refresh process requires for Aboriginal community control to also agree with the new targets. We said, absolutely, we weren't going to sign off. The government did not consult with us. They were going to again put policies and frameworks forward without our input. And so we were really brave to say to government and to force them to listen to us. Now, out of that, we now have, and we're the only organisation that has this, an equal partnership with the Commonwealth Government through COAG, a 10-year partnership around co-design, implementation around what Closing the Gap will look like. Out of that, we now have the Coalition of Peaks, 40 plus members of Aboriginal and Torres Strait Islander peak bodies that will actually form policy, will actually have a say around how the funds will be dispersed. It's historical. I really look forward to looking back in 30 years' time about how significant this partnership has been, because we now have an equitable seat at the table, and we've, as blackfellas, we've never had that. To be able to have a shared role in decision making on matters that impact us is significant, and we're so proud that we have that partnership.
And that's got bipartisan support, doesn't it?
Absolutely, yes.
Now, you know, there's people in your life that you just could talk to for hours. Donella is one of those people in my life, and really what I wanted to do with this session was give you all access to her, because her depth of insight and experience is really phenomenal. So we've got another 15 minutes, and I have got so many questions, there's no way we're going to get through them, but I do really want to invite opportunities to hear from people in the room, to put your questions and your reflections back to Donella. So we do have roving mics. Please give me a wave and let me know if you've got a question, and I'll come to you before we finish up. Donella, looking after our people is a key focus for us here at Health Justice 2019 over the next 2 days and ongoing. Can you tell us a bit about how your work impacts on you personally and on your colleagues?
Enormously. What I do is I tell myself, this is not sustainable long term. This is not good for my health and my well-being to continue to do this role long term. It has a disproportionate impact on me because, of course, I'm working with my own families. I'm working with what are my kin. So that has such a significant hold over your... It comes with many complexities. It comes with a complexity of, I have success, I have this wonderful role, I'm so passionate about it, and I'm in a community where my people are living in poverty. I have good health, I'm working with families that have chronic disease. Their burden of disease is 2.3 times higher than non-Indigenous Australians. So I'm always in this balance of trying to find the harmony. And where the harmony for me is that I get to be with my own people, I get to identify consistently who I am every day, and I get to be challenged by it. I forgot to say to Tessa a couple of questions ago, that working in this national space, I've heard for many, many years around the structural barriers that Aboriginal and Torres Strait Islander people face. Oh my gosh, the truth behind that is so significant. Our voices are so minimal. And all of us in this room, we know the numbers, we know what the overrepresentation of First Nations peoples, what that looks like around domestic violence, child protection, out-of-home care, the whole gamut of things. And it is about systemic change. It needs to be system-focused, it needs to be structural reform, and it needs to be policy change. So yeah, disproportionately the impact it's just enormous, Tessa. I don't want to try and make that less significant than what it is. But yeah, it's a space that I cannot be in for too long, because it's really soul-crushing to work across systems that are so challenging, and so much energy is required, and I have a huge amount of energy, but I know that it will come to an end before too long. So I really look to other practitioners across the health and justice domain we have to work in teams, we have to collaborate, we've always got to look for new money, all of the challenges that we face. And then the other challenge, which is the positive, is that I'm a black fella. So my people are screaming at me about, they want me to make all the changes. It's really hard for me to communicate to them that I'm one person that's trying to assist. I don't have the power to bring good housing. I don't have the power to bring their kids home. I don't have the power to be able to get them back on their homelands. So it's this constant conversation of trying to express love for my community, but also a truth that doesn't further traumatise them.
Talking to NACCHO over the past year about the work that's been happening through the Coalition of Peaks, it is a really momentous event and its potential is huge. And as you say, at the same time, we know how horrific the stats are, and people in this room alongside you are working every day with the lived experience of poor health and unmet legal need, injustice around the country. So it's hard to get a sense of whether we're making progress and what progress looks like. Do you think we are?
We have to be optimistic. We've all got to be positive. The Coalition of Peaks, the Closing the Gap, the partnership that we have, that is a game changer. That is going to bring about such a turn of events. We have never had a real voice at the table. We now have every right to be able to feed into policy, and that is going to bring that structural reform. As far as, we all know about the cashless welfare card, robo-debts, the wonderful working for the dole programs that the government, we just want government to work with us, work alongside us and respect us. We don't want them to keep coming up with these great ideas around, cashless welfare card, and we just need to do things differently. So I'm hopeful that now that we have a signed off wonderful contract with government, that is going to force them to actually work with us. They need to be forced.
So you talked earlier about power and the lack of it, but also how strong it can be in a community-controlled context.
Yes.
What impact do you think constitutional recognition would make to that end?
That's a must do. That has to happen, and if it doesn't happen with this current government, then we all know that Labor, when they get into power, which wish that was sooner rather than later, that will happen. We have to have constitutional change. The Uluru Statement from the Heart is very, very clear, and I'm very blessed that I'm a signature on the statement. I was fortunate enough to sit at Uluru and to design and to walk away with a clear gift for all of us. And that for me is a deal that is absolutely happening. And if it doesn't happen now, it will absolutely happen. That is fundamental, Tessa. That just, and the government keeps putting out scare, out through the media around it being a third chamber. I mean, it is just for us to have a voice. We don't need to be scared. For the past 250 years, as of next year, we just need government to listen to us. I work in communities, we all work in communities with clients that are extremely vulnerable, that are voiceless. And to not have a voice amongst all of the other factors of your struggles is the worst thing. So constitutional recognition, substantive recognition is a must.
Now, again, invitation to people in the room, please let me know if you've got a question or a response to what you're hearing. We really want this to be an interactive 2 days, and we'd love you to get the ball rolling. So we've got a couple of hands going up. I will come to you. I just wanted to round out that point about constitutional recognition, Donella, in terms of the other core elements that the Uluru Statement from the Heart calls for, which are treaty and truth-telling. And I'd be interested in hearing at the end of this session your reflections on what those elements look like, and particularly for people in this room. So let's take that first question at the back, and then we'll take a second question just down here at this table, and then invite Donella to respond.
Thank you, Donella and Tessa. I'm Harriet Hiscock. I'm a paediatrician from Melbourne. Donella, thinking about children, in particular, and you mentioned out-of-home care, etc. If you had your magic wand, what would be the first few cabs off the rank for you in terms of changing what happens now?
Magic wand.
Yes. I'm thinking at systems level here.
Housing. If our families had housing, the risk would minimise. Housing would be for houses just to pop up out of the ground. We often hear about, overcrowding. Well, why is that? Because there is such a shortage. And it's not just housing, it's healthy housing. We need to have homes that are appropriate. So yes, my answer to you with my magic wand would be just for houses to pop out of the ground.
I think there was a question down here, and please do introduce yourself.
Hello, Donella and Tessa. My name is Paula Novotna. I'm a lawyer with Legal Aid, and I work in Mount Druitt. And we work in partnership with an Aboriginal health service and also with mainstream Aboriginal health, and we're in the hospital. I guess what I would really benefit from your insight, I guess, for those of us working on the ground in community, you've got this national focus. So what would some tips or advice to us? Big question, but...
Do you mean advice in working in that setting, or?
Yeah, I think some take-homes from the national agenda that could be helpful for us in like day-to-day work.
So some of the key priorities that we have are youth detention, our children being removed, being funded appropriately based on need, because our burden of disease is so high. I would say to the lawyers in the room, it is taking that deep dive and understanding that if you're working with Aboriginal and Torres Islander people, health is such a factor. We've got to be really willing to run towards holistic care, looking at the whole. What I would say to you is look at the whole person, look at their community, because in that is their spirit, is their culture. There's such a complexity around that. I would say that to you. Just would be a take-home tip that when you're working with First Nation peoples, we are such a deadly bunch of individuals. We're so diverse. We have these amazing ways of being that have been our survival. I'm not just Donella. I come with an enormous population behind me. And so when I'm working with my people, that's how I work. I work across a community. Don't work, and that's a really difficult concept for lawyers to take on. But yeah, it really is working with the whole person, which is the whole community.
Thanks, Donella. Any other questions? One more down here. Thank you, Annette. This will be the last question for this session.
Thank you. Annette Michaud from the Parenting Research Centre. Thank you so much. It seems like there's so much amazing work happening in the kind of health justice space. A lot of the work I do is in the welfare space, child welfare in particular. What's the one thing we could do in that sector to support you? What's the change you'd like to see, and how can we support you better?
What I've found at Wuchopperan Health Service, where I'm based, is we offer a whole suite of services. A couple of the services we offer are family wellbeing. We're a recognised entity as far as working with kinship carers. And sitting on the board, what I soon discovered was the way that we're funded is to do this sort of piecemeal dance with families. But none of it was about working with families for them to understand their rights. Nothing. So what I'm seeing is my people working in systems where they're just sitting in a situation, just nodding their heads because there's no legal representation. So they're put into these isolating environments where that window of opportunity where services can come in and work with families to try to, take the pressure out of the kettle so that families can stay together, that just evaporates. So what I would say to you is to try to keep that window open by trying to get them connected with services, and that is also getting them connected to a legal service.
Thank you, Donella. I want to invite you as we close this session to reflect on those other two priorities coming out of the Uluru Statement from the Heart. In this discussion we've talked a lot about voice, and indeed that's what is getting most of the attention on the national stage, but those really critical elements about truth, about treaty and truth-telling stand side by side with voice. So invite you as we close to share any reflections that you have with this room about the importance of those elements and what we can do as part of a movement supporting the Uluru Statement from the Heart.
If I can really focus on truth-telling. Truth-telling is so healing. It is the key ingredient for all of us as Australians to move forward. We have to stop this disconnection that we have with owning the fact that we come from a really painful past. Through walking through that together, there is such a wonderful possibility of really setting a new nation. And for me, that's what the Uluru Statement from the Heart represents. It was something that shows how smart Aboriginal and Torres Strait Islander people, how smart we really are, that we could develop this statement of love and kindness. It was an offering to all of us to walk forward together. The truth-telling is it's so key, Tessa. Treaties, that's agreement making. I don't want to spend too much time on that because, some jurisdictions are moving forward in that, and that's a real positive. But for me, it has to be embedded in that constitution. It's so important. When I think about history and I think back to the days of ATSIC and other amazing peak bodies that have represented Aboriginal and Torres Strait Islander people, through the whim of government, they can just, that's now no longer. We all know how hard it is to move through the funding wheel. We need to have something that pins us down into this nation, and it has to come in the form of constitutional reform.
So the Uluru Statement from the Heart was a message not to government but to Australia. It was a message to all of us. It is the first formal policy that the Health Justice Australia Board has signed onto as an expression of our commitment, and I would really encourage you to consider that and reflect on that in the course of the discussions that we're going to have over the next 2 days. Please join me in thanking Donella for her incredible generosity in this session. Thank you.